My name is Dawa Sherpa. I'm part of Team 15, and my bio role model is Dr. Lieven Schenk. He is a Swiss neuroscientist, a Max Planck Fellow, and an Ig Nobel laureate. Now, he received his doctorate at the University of Hamburg Medical Center in Ebendorf and his postdoc at the University of Maryland, Max Planck Society, and the University of Hamburg Medical Center Ebendorf again. I'm going to be upfront. He is a very private man, and his personal life is not on the web or on any of his biographies at the institution that he works for. So I cannot list any of his sports or how he got into science, but these are the schools he attended. Now, his hobbies include hiking and sightseeing, speaking over 4 languages. This is an image of him from his Facebook enjoying the Swiss Alps right near where he grew up. And this is a picture of the Large Hadron Collider in Switzerland. Now, his most recent research titled How Side Effects Can Improve Treatment Efficacy, a randomized trial, reflects his main focus of research, pain and how the brain could possibly be suppressing prediction error signals. Prediction error signals is basically how the brain learns from its mistakes. You predict how a situation's going to go, and it doesn't go that way. And so the brain doesn't make that mistake again, usually. And main question, how does placebo hypoalgesia work? Placebo hypoalgesia is the pain relief that patients feel after being treated with a placebo, even though a placebo doesn't have any pharmacological effect. It isn't formulated for pain relief. That's just a mental effect of taking medicine. And so in this research, this is his control group of nasal sprays. He had 2 groups. One group was told this nasal spray is going to relieve your pain when you feel a hot sensation on your arm. And this group was told, hey, there's no active ingredient in this nasal spray. If you feel a difference in pain, it is purely because the temperature happens to vary. Now, as you can see, this is the active nasal spray. This is the active treatment, meaning that there is capsaicin in the nasal spray, which burns your nostrils. This is the inert nasal spray, meaning that it's just saline solution. There is nothing in it to cause any sensation. And this is the control nasal spray, just to establish a baseline. And this is a 0 to 100 pain rating. This is the baseline set at a higher temperature to see how people would react. And this is at a lower temperature when the placebos were administered. Now, both groups, the group that was told the placebo treatment and the group that was told it's just your perception, they both went into an MRI, and this is signaling in the brain that shows up, regions lighting up that are associated with the pain regulating system of the brain, RACC and the PAG, 2 parts communicating with each other, which points toward the brain, modulating pain in response to that painful stimulus. And they tested their hypothesis that people who feel this painful side effect that they usually associate with a stronger treatment because they believe that side effects are inevitable when a treatment is effective, that expectation effect actually affects how much they feel pain. Well, to put a long story short, having a painful placebo actually reduces their pain in the long run as opposed to a non-painful treatment. As you can see, there is a significant difference between the active painful nasal spray and the inert nasal spray in the expectancy group. In the non-expectancy group, they're pretty much the same. Now, why do I admire Dr. Schenk? I admire him because he embraces both the serious, facts and figures of science, but also, the more mental, more unquantifiable part of science, where the mental aspect of healing and how factors that we can't necessarily control all the time also contribute to how well you feel. These are my references, all the smart people that contributed to this presentation. And this is the second page of references. And here is our man right here. Thank you.